Hello.
Hi, Doctor.
Good morning, doctor.
Okay, can you select? Let me see my slides.
Yes, doctor.
Yes, Doctor.
Yes, Doctor.
Okay, so let's continue with our lecture for today. So basically, this is a topic on parturition and its induction. So before this, we have discussed about how a new conceptus is formed and then how it goes through the embryogenesis process and how it ends up with a new offspring, right? During, after completing the gestation period or the pregnancy period. And meanwhile, we have also discussed about the possible reproductive problems that you may encounter during the gestation period, right? But assuming that, the gestation period or the pregnancy is safe from all those kinds of disorders that may be encountered during pregnancy, and you are able to succeed to end up with the normal parturition process. So we need to know what parturition is about, and we need to know also how we can be able to induce parturition artificially when it is needed and the reasons behind. So that is the topic of our lecture for today. Okay, so parturition. So this parturition, or sometimes is also known as labor, is by definition is just a process of giving birth to a new offspring, right? And this is a physiological process which involves, the expulsion of a viable fetus that is mature enough to survive individually out of the maternal body. That's basically from the uterus, right? So that is generally the definition behind the word parturition. So what triggers parturition? How the parturition process starts? So when we talk about the triggering factor, basically it comes from the fetus itself. After the fetus completes its development and is already mature enough to live as an individual, then there will be a stress factor which is going to be adding up on this fetus within the uterus. So that will lead to a complex cascade of processes that will end up with the delivery of the fetus. So this requires the interaction between the endocrine system, the neural system or the nervous system, as well as some mechanical factors also are required for this process to be completed as a success. So even though we know that the endocrine system, the neural, the nervous system, and the mechanical factors are involved, it's yet, still not completely understood how those different parts of the body system are coming together or how they interact to each other to end up with the successful parturition at the end of the day. So the whole story is not very well as understood, but there are scenarios, there are theories behind how this process is completed. So we will discuss that to the level of the scientific understanding at the moment. So for this process, from the successful parturition to occur, one of the main factors, as I mentioned, is the mechanical factors needed all right? So there are basically two mechanical factors, two mechanical process during parturition, which are definitely required. Otherwise, you will end up with a problem of calving, which is what we call dystocia, dystocia, which we will discuss on another lecture. So the two main mechanical process required includes the one that comes from the uterus, which is a contractile activity of the uterus to push the fetus to the to the birth canal. And the second important mechanical factor is the relaxation of the cervical canal. Well, that's one of the main part of the birth canal. So cervix needs to be relaxed, needs to be, to open up, to allow the fetus to be delivered out. So these are the two mechanical factors, along with the endocrine and neural functions needed during the process of parturition. So here it gives you the whole idea behind the process of parturition in a schematic diagram. So as I said, what triggers the whole process of parturition to our level of understanding at the moment is the stress factor on the fetus. So as the fetus grows and gets mature, becomes almost close, near to become an independent individual, the requirement for oxygen and nutritional supply is going to be very high. So the demand will be very high. So it's believed that this requirement by the fetus and the inadequacy of the supply coming from the maternal secretion is the one that is becoming like a stress factor to the fetus, triggering the fetus to release stress hormones, which we know that cortisol, right? So before, of course, the cortisol is released, we have the ACTH, which is adrenal corticotrophin hormone, which comes down from the pituitary gland, and the stress factor will have impact on the hypothalamus before that. So then we will have this hypothalamo pituitary adrenal axis to be triggered. So with this cascade, ACTH released from the pituitary, and then it goes down to the adrenal gland, and leading to the release of the cortisol hormone. So when this cortisol hormone increases in the blood circulation, it will have these two different actions. So on one way, it will induce the conversion of the existing progesterone circulating in the blood. So remember that the pregnancy is maintained by the progesterone hormone, which comes from this corpus luteum of the ovary of the dam, right? So we have this circulating progesterone level, which is high in amount to maintain the pregnancy. So when the cortisol level increases, it will induce the release of enzymes, these aromatase enzymes in particular, which are involved during this, what you call the steroidogenesis process. So they will break down the circulating progesterone to be converted to estradiol or estrogen. So this is one of the main effects of the cortisol. On the other side, because the progesterone is coming from the corpus luteum, so we should have some mechanism by which this corpus luteum is going to be lysed or regressed. So obviously we know that it is a prostaglandin that plays the role of regressing or causing regression of the corpus luteum, right? So this will be induced. So there will be a complex process that will take place during the luteolysis. So one of the factors which is required for that process is cortisol. Will go to the receptors on the endometrium within the uterus, and this cortisol will trigger interferon tau and other signaling molecules, and then that will lead to the release of prostaglandin by the endometrium. Ultimately, this prostaglandin will go to the corpus luteum to induce lysis or regression. So that will terminate the production of the progesterone. So on one hand, the existing circulating progesterone will be broken down to estrogen. On the other side, the main source also is being terminated or is being regressed. So meaning that progesterone supply will be terminated. So that is one of the consequence of having this cortisol in the circulation. On the other side of this endocrine reaction, or during this parturition process, there will be also release in prolactin. So this prolactin also is released from the pituitary gland, from the anterior pituitary. So the increase in prolactin is very important to the relaxation of or stretching of the pelvic ligaments. So the ligaments needs to be relaxed and stretched so that, the birth canal will be increasing in its space to allow the fetus to pass through. So that is another consequence that we will have during this process. So now, after that, we have this progesterone being converted into estrogen. The estrogen is going to have the following effects. One of them is it has a contractile, effect on the uterus, right? So the myometrium will be contracting, and that is what we need as one of the mechanical factor for the successful parturition process. On the other side, this same estrogen will have impact on the secretion of the fluid along the birth canal. And this secretion, the mucus secretion, is basically important to lubricate the birth canal, all right? So that lubrication is also very important during the delivery process. So that is, again, contributed by the estrogen converted from the progesterone. So when we have this contraction from the myometrium, from the wall of the uterus, obviously we will have a pressure that builds up to push the fetus to the outside, right? So that will have also a subsequent effect on relaxation of the cervical canal, because as the uterus contracts and with the fetus and other content within the uterus, it will push and create a pressure on the cervix to be relaxed. So there will be a stimulation effect also on the cervical canal for it to be, to be relaxed or to start to open. On the other side, this also will trigger the release of oxytocin, all right? So the oxytocin also will be released. Again, this is a hormone that comes down from the pituitary gland. And the oxytocin, as you know, or as you might know, its effect is basically to induce contractile activity on the uterine wall. And of course, it does have also additional role as a milk let down, but on the uterus, it will have that contractile activity. Very vigorous contraction can be induced by using oxytocin on the wall of the uterus. So with this impact of contraction on the uterus due to the oxytocin release, coupled together with other contractile effects of the estrogen itself, and with the ligament stretching and lubrication of the birth canal, altogether will have an ultimate effect for the whole process of parturition to be completed by birth or giving to a new being. So this is the whole process as far as our scientific understanding is concerned at this level. What we know, what's happening during the parturition process and the various factors involved to make this process a success. Okay, now let's see the stages of parturition in detail. What happens? So generally we have got 3 stages of parturition. The whole process can be classified into 3 stages. So we have stage 1, which is mainly characterized by dilatation of the cervix. And the stage 2 is mainly defined by the fetal expulsion, or the expulsion of the fetus out of the uterus, out of the birth canal. And the last stage, stage 3, is characterized by the expulsion of whatever left over, which is basically the placenta or the fetal membranes. So when we talk about stage 1, which is, as I mentioned, marked by dilatation of cervix, but of course, before we do have the cervix dilated, we do have other, expressions, other signs of parturition being expressed by the dam. And among these, one of the things is the contractile activity of the uterus. So there will be regular contraction by the uterus during this stage before, of course, you get the cervix completely dilated. And the period of the stage 1 is from the start of this uterine contraction until a complete dilatation of cervix is achieved. So how do we know the cervix is completely dilated? It's very important to understand that the wall of the vagina has to be in a direct continuation with the wall of the cervix when it is completely dilated. So this is what you see here is during pregnancy, which is tightly closed here, the cervix appearing to be like whitish structure here. But when the parturition process starts during the stage 1, this opening starts to increase, right? And the wall of the cervix getting relatively, thinner and expanding until it becomes completely in a straight line or in a continuation with the vaginal wall. So that is how you confirm that the cervix has completely dilated when the line, the mucous membrane of the cervix is in alignment with the wall of the vagina from inside. So what other events do we have during this time? During the stage 1 that we see from the dam is restlessness. Animal, you'll see the cow, the dam having that behavior of sitting down and standing, those kind of activities. Basically, you'll have also an increase in terms of pulse rate, also respiratory rate, basically because of the pressure developing in the abdomen, the contractile activities. And we do have also the adjustment of the fetus in the delivery posture, position, and what you call presentation. So we'll discuss these parameters later. So the fetus will arrange itself in a position that will allow to be delivered in a normal way. So that is very important. And basically the normal expected position and posture is going to be anterior, dorsal position, and with the extended forelimbs and heading, resting on the forelimbs. That is what is expected as a normal orientation for the fetus in a normal process of delivery. So stage 2. So what do we have in stage 2? As I said, this is mainly characterized by having, expulsion of the fetus. And the period is obviously, it continues from the stage 1, which is marked by the complete dilation of cervix. So once you have the cervix completely dilated, right from that time until the end of the fetus delivery, then that is a period for stage 2. And during this time, you will still have that mechanical force of contraction from the uterus as well as from the abdomen. So you will see abdominal contraction also being visible during this stage. All right. And what other events do we have during this time? During stage 1, usually animal will be like, with activities of like standing and sitting down. But usually at stage 2, you will see the animal being recumbent. So we'll be sitting down on the ground and keep straining. So the straining is due to the contraction from the uterus as well as from the abdomen. And then you will also see the breakdown of the fetal membranes and the fetal sacs. So remember the fetal sacs. We have two major fetal sacs, right? The allantoic sac and amniotic sac, right? So the first one to be broken down is going to be the outer sac, which is the chorioallantoic sac or the allantochorion. And then you'll see a fluid coming out from the birth canal during this time. And then this will be followed by the breakdown of the second fetal sac, which is the amnion, and this is also known as the water bag. And now once this rupture, a lot of fluid will be discharged during this time from the vulva. You'll see that the membrane or broken part of the membrane being visible outside the vulva. So ultimately, once you have all these membranes broken down, obviously the fetus will be exposed and it will be completed by the delivery of the fetus if no obstacle is there. If the whole process is normal. So this is an example of a stage 2 parturition cow, how you will be able to see. So here you can see the forelimbs being visible from the vulva with the muzzle of the head and the tongue being visible from outside. So definitely, and you can see the animal is in a recumbent position. So, and if you have a live kind of picture, video to see, you will be able to see also the contractile activity from the abdomen and the uterus. So basically, this is what you see in a real scenario. You can see the forelimb, the head coming forward in anterior presentation. Same is true, much more progress stage 2 of parturition. which is almost halfway, is already out. So we don't expect much problems after this. And then last stage is stage 3. So this stage of parturition is characterized by, as I said, by the removal of the fetal membranes or the placenta, sometimes known as, placenta. But what happens during this stage is right after delivery of the fetus in stage 2, right? Then the contractile activity decreases. So abdominal contraction, uterine contraction will decrease up to the limit that is going to stop, all right? Will stop actually during this time. So this is a time of relief for the dam actually, because of after straining and contraction to push the fetus out of the birth canal. So this period basically lasts from the end of the stage 2, which is marked by the expulsion of the fetus, until the expulsion of the fetal membranes, all right, which can take hours or like a day, half a day, normal condition. So what additional events do you see during this time is, as I mentioned, the straining activity will stop, all right? And then we will have also the loosening of the attachment between the fetal membrane and the endometrial layer. Remember when we talk about placentation, this is, we're talking about the cotyledonary type of placenta, whereby the chorionic villi, the villi will be, inserted or will be locked into the crypts of the maternal caruncles. So now during this time, this attachment will start to loosen by different mechanisms, particularly by some enzymatic actions to break down, the proteins, and resulting in the detachment process during this time. So ultimately, in normal situation, this fetal membrane will be detached from the endometrium and will be removed out of the uterus. So this is a table which shows you the timeline for the various stages of parturition in different species of animals. So here we have got for cows and buffalo. For the stage 1, it takes around up to 6 hours for this stage to be completed. But this is especially counting from the observation of, the contraction of the abdomen or the contraction of the uterus until you see the cervix is completely dilated. Otherwise, especially in heifers, you might see a bit longer kind of behavioral expressions, like including like sitting and being restlessness or having that restlessness behavior. It can last up to 12 hours, even more than that in those heifers. So this is basically when we talk about once you see this active contraction of uterus until the time you see the cervix is completely dilated. And then for stage 2, which is shortest time period for all species of animals compared to the other stages. So it will take like half an hour to 1 hour period for the fetus to be expelled. So once you have cervix completely dilated, the breakdown of the fetal membranes, the water bag, and then removal of the fetus is going to happen within 1 hour period of time. So if this is going to be delayed more than this, then you have to expect problems and you need to be ready to assist. And the last stage is the longest period. It can take up to 12 hours in normal condition for the fetal membranes to be removed. Otherwise, you have to consider this as pathological, and then you need to do intervention. You need to intervene and to help to this problem. In mares, it takes about 4 hours for the cervix to be dilated, all right, to be completed. And for stage 2, it's relatively much shorter than cows, what we see in cows. It takes about 20 to 30 minutes, all right, just a maximum of half an hour. So this is a much quicker kind of expulsion of fetus, and much faster even when it comes to the expulsion of the fetal membranes, all right? So basically, this might be attributed to the nature of the placenta that we have. Remember the kind of placenta we have in mares? It's a diffuse type, right? So this is probably one of the reasons why the detachment process is so quick and it can be completed within 1 hour. In small ruminants, like in ewes, you expect around 6 hours, similar to what we see in cows. And the same is true like for fetal expulsion. It may take up to 2 hours, a little bit longer. And basically remember that these animals are polytocous. So we may have more than one fetus, so the time can be longer and logical, and it's realistic. An expulsion of the fetal membranes are expected to happen within 8 hours of period. In sows, so we have a bit longer time period for this, up to 12 hours it can take. And even for stage 2, it can take up to 3 hours. And I think we shouldn't be surprised because sow is also another polytocous animals having multiple fetus, so, they can, I mean, it's not a one-time kind of expulsion for the whole fetus that they have. So the fetus will come one by one, so that will take time. So we expect a little bit longer than what we see in other species of animals. Expulsion of fetal membrane is more or less similar to what we see in mares because they do have the same kind of placentation, right? So it takes around 4 hours for it to be expelled out for the stage 3. All right. So that's all about parturition, a normal process of delivery, what will happen and what we expect. And that doesn't mean that nothing wrong happens during this process. Obviously, we could face many other problems. And one of the major problems is when this process is having an obstacle, not able to complete with the expected timeline that we have discussed just now, then we call it a dystocia problem. That's a difficulty in birth. And that is a time where assistance will be needed. And we'll have a lecture on that topic on another session. Now let's talk about induction of parturition. So artificially, you can induce parturition. Now we know, at least to the extent that we understand at this level, how the process of parturition takes place, right? How the physiology behind parturition looks like. But now, how can we artificially induce using medications, using drugs? How can we be able to induce when it is needed? So induction of parturition. So the first thing is why we need to do this, why we need to induce parturition, all right? So one of the main reason or indication for induction of parturition in animals is for management purpose. So management in a sense that you may want to have a very tight calving period, for example. So you induce all your cows during the same period of time, and then you can have calving taking place in a tight time window of period. So that's one of the reason, one of the indication that you can be able to induce parturition. And relatively common in cattle as well as in pigs, but less common in other species of animals, including horses as well as in small ruminants. That is for management purpose. But the other main reason or indication could be when you have a health issue, when the dam, either the dam or the fetus or both of them are at risk of life for health, for their health, then you can terminate the pregnancy. You can induce parturition, terminate pregnancy by inducing parturition. So this can be done to, irrespective of the species of animals. It can happen to anyone. So when you have this kind of condition, then you can go for induction of parturition to terminate the pregnancy. So we do have various types of drugs available, but basically the principle behind the use of these drugs is to imitate, or it imitates the natural parturition cascade that I described to you before in the diagram. So it depends on that mechanism, all right? And you know that generally we do have the neuroendocrine activity being involved during the parturition process, in addition to the mechanical factors that we have mentioned earlier. So our induction process using drugs will be mimicking those kind of events happening during the normal physiological process of parturition. So continuing the indications in the various species of animals, to see it in a bit more detail. So one of the indication in cattle is, of course, to terminate undesired pregnancy. This is, for example, maybe you have a cow meant for breeding using a selected semen from a Frisian bull. But unfortunately, maybe a bull suddenly comes up and then mount the cow inseminate it. So you don't want that kind of pregnancy, isn't it? So if this is the case, then you can induce the parturition, terminate pregnancy, and go your pre-planned breeding schedule. So that can be happen. Another thing is we mentioned about the reproductive problems, particularly associated with pregnancy in our past two lectures. So one of the examples is like, for example, when you have an mummified fetus, that can lead to, you know, a prolonged gestation period out of the normal gestation period, then you have to induce parturition to terminate this condition. In other words, is a treatment procedure or option for this kind of pregnancy-associated problems. Another indication is to avoid prolonged gestation. One of the reasons I mentioned is mummified fetus itself, all right? And we know that when a gestation period is prolonged with an active, normal, viable fetus inside the uterus, then definitely the consequence is going to be absolute oversized fetus leading to a dystocia. So that is something we don't want it to happen. And to avoid this dystocia happening, then you have to induce parturition. And in fact, you may have heard of this even in Malaysia. There is a particular breed of cattle, especially like in Terengganu and Kelantan. A lot of people they breed this animal, which is having what we call this double muscle, cattle breed. I forgot the name of the breed. You might know it. So those breeds of cattle, if you crossbreed with another breed of cattle, maybe with a local breed of cattle, the ultimate result of the pregnancy, the fetus will be huge, oversized. All right, for the cow to normally deliver it in a vaginal pathway, or to perform vaginal delivery. So with this kind of condition, what you could do is, before it gets to a maximum size that leads to dystocia, you could be able to induce a parturition earlier, so that you can also avoid the occurrence of dystocia problems. So that is another management strategy by which you can also apply induction of parturition. Another indication is, again, hydrops of the fetal membranes, allantois, or hydramnion. Those can also benefit from induction of parturition. Maternal illness, anything related to health risk, as I mentioned before, can be handled by induction of parturition. All right, can be attempted by induction. Of course, induction of parturition may not resolve the problem, but it can be as one of the options of management. And as part of management, I mentioned that it can be used to tighten the calving period. So that is additional indication for induction of parturition in cattle. So what options do we have in case of cattle, for example? So the choice of your approach or the method of induction for parturition, it depends on, one is the stage of pregnancy, all right, at what stage? Is it during the first trimester, during second or last trimester? All this will have impact on the choice of method of induction. Number two is the speed of time, during which you are expecting the response to occur. So that will be your second important factor to be considered. So having this in mind, you can classify the pregnancy period into different stages, right? So the first stage is like until 120, 150 days of pregnancy. That means during the first 5 months of pregnancy. During this period, the main source of progesterone that maintains pregnancy is corpus luteum in cattle. So meaning that your target method of choice should be a drug that will be able to regress corpus luteum and terminate the production of progesterone. And that drug is what? Prostaglandin, right? So we use prostaglandin during this period, and you can be able to succeed inducing parturition or causing abortion within a period of 3 days' time, right? So, but of course, after induction, you cannot just let the cow to do by herself, but you need to have also a close observation in case the process of parturition faces a problem in the meantime, so that you can be able to provide assistance. The other period is after 120 days, all right? So now this is in the midterm period of pregnancy. So you know that from the beginning, we have the corpus luteum, but as the time goes on, the placenta also starts to produce some amount of progesterone. So it's not only CL, the corpus luteum, in charge of progesterone production, but also we do have the placenta. So meaning that when you consider induction of parturition during this period, you have to target, or you have to opt for a method that will also address both sorts of progesterone. So meaning that you have to combine, you have to consider the use of dexamethasone as well as prostaglandin, or maybe you can just consider the dexamethasone, the corticosteroids alone, because corticosteroids will cover up both actions. I mean, both progesterone from the corpus luteum as well as the action of the release of cortisone by mimicking the stress factor in the fetus during the parturition process that we described earlier. So here you can use up to 25 milligram dexamethasone given intramuscular, but of course the response might take time, may not be a very quick kind of response that you can be able to achieve, all right? And of course you have to still observe the animal for any possibility of facing dystocia to assist. Now, the other time period is after 250 days, which is getting close to the due date, close to the parturition time, right? We know that gestation is about 280 days for cattle. So, and during this 25 days period, 150 to 175 days. So in this case, you can consider, again, the corticosteroids. In this case, you can use the short-acting corticosteroids, like the betamethasone, all right, around 25 milligram of it injected intramuscularly. Then you can expect the delivery within 5 to 11 days. If you see no progress from 5 days onwards, then you can, combine by giving an injection of prostaglandin after that to fasten the process of delivery. But your priority will be the betamethasone, the short-acting corticosteroid. Now, when it is very near, 280 days, right? Or maybe if you have got already passing this timeline, meaning prolonged gestation after, then in case you can consider the two or a combination of the two, all right? A corticosteroid and or PGF2 alpha. So we can consider these two. So the best will be combination, and it gives you a much faster response. So in this case, I would recommend to use both PGF2 alpha and the medium acting or short acting corticosteroids. So you can get a short time response of 26 hours when you give combination. In horses, that means in case of mares, the indication is health issues, as we described before, all right? And then in addition to that, you might also induce parturition in the mares for research and teaching purpose. But one thing important to remember as far as mares are concerned is that the gestation period is quite variable, all right? So prolonged gestation may not be considered as an important indication for induction of parturition in the case of mares, as we discussed in the case of cattle, right? For cattle, that's important. So because the gestation period is quite consistent. But in case of mares, there's a wide variation in gestation period, which is considered to be normal. And not only that, the fetus in the case of horse or in mares, it doesn't actually grow indefinitely. I mean, it doesn't keep growing as it is in the case of cattle. So meaning that there is a limited growth stage in the fetus. So even though the gestation period is prolonged, we don't see that risk of having an oversized fetus in the end. So with this condition, we don't have to consider gestation period as our criteria to decide, whether we need to induce parturition in the male or not. So talking about the methods of induction for parturition is also a little bit different compared to cattle. So we have got the first 35 days of the pregnancy. And this period of pregnancy is a time period where we don't have the endometrial caps. So in males, we do have what we call these endometrial caps developing from the endometrium from 35 days onwards. So these endometrial caps are involved in the production of progesterone. So meaning that when you think of giving or when you think of inducing parturition, you have to take this into account. So for this period before 35 days, where the progesterone is coming solely from the corpus luteum, then you can be able to handle the induction process using prostaglandin alone. All right, prostaglandin. So meaning that, of course, you have to diagnose the stage of pregnancy correctly in this case for a good result of induction of parturition to occur. And the indication during this period of early pregnancy is most likely it can be having a twin pregnancy too. So you remember that twin pregnancy is one of the main causes of prenatal loss, right? If you remember. So one of the prenatal loss causes is twin pregnancy. So this is also a cause of like infertility animals because males naturally are not able to support 2 fetus at a time in a normal gestation period. So in this case, whenever you have a twin pregnancy, you have got to terminate one of them and allow the other one to continue. I think one of the students from your group have asked a good question related to this, which I responded via email. I think later I will share via Putra Blast with the additional questions, asked by email. So we have to consider that species difference and that particular nature in the males when we consider the method of choice for induction of parturition. So the other time is after 35 days, meaning that once you have the endometrial caps developed. So, and in this case, you can consider injection of PGF2 alpha plus, that's not enough, but you have to do manual dilatation of cervix. So there are some obstetrical devices that can help also in this process. We call it cervical dilator. You can also do, and also using manually, you can help to dilate the cervix, and then followed by uterine irrigation using warm normal saline. So this is going to be after 12 to 24 hours of injection of the prostaglandin. So irrigation will facilitate the removal of the remnant part in the uterus. So the other time period is at or near term. All right, it's already due date. Okay, so this is obviously subject to fetal maturity. So we hope that the fetus is fully mature. So in this time period, you do have the options of using oxytocin, prostaglandin, as well as corticosteroids. They can be used, but the option of the drug of choice during this time is going to be oxytocin, all right? The reason is that oxytocin acts very quickly and it can induce parturition within 1 hour period compared to other options of treatment that we have. So how we use oxytocin, there are 2 main methods or procedures by which you can deliver oxytocin to the animal. One is via injection, another is by IV drip, by saline, together with the saline. So what you do is you can mix up, you can mix maximum of 100 international unit oxytocin in a liter of saline solution, and then you run this with the IV drip to finish within an hour. So if it is 60, is about 6 international units per minute rate of flow. With the IV drip, you can give so that the induction process can be induced. We expect the delivery within, to commence within half an hour period. all right? And the moment you see the process started, parturition process started, then you can stop the IV drip. On the other side, the bolus IV injection, all right? Instead of giving it as a drip with the saline, you can also give just IV direct injection as a bolus. So in this case, the dose can be reduced. It can be reduced. You don't have to go up to 100 international unit. You can reduce because you are going to give it as a bolus injection. And then in some cases, you might need to repeat. And if you feel that there is a need to repeat without response, then you can do that after 20 minutes or within 20-minute time interval. And when you compare the two methods, the IV drip with that of the bolus IV, the bolus IV tends to produce a much better effect. I mean, much faster effect in inducing the parturition in the mares. All right. So generally speaking, this is not only for the mares, but for other animals after induction. You have to be observing animals also for any possibility of requiring assistance during delivery. Okay, in other animals, like in sheep, the indication is like pregnancy toxemia. This is relatively common in small ruminants, as we discussed in our last lecture. And of course, delayed parturition can be also another indication in these animals. So what do we have as a choice? One of the main choice in the sheep is corticosteroid. So dexamethasone or betamethasone will be the option of drug to be used. You can give about 60 milligram intramuscular, and we expect within 3 days time interval, I mean, for the response for parturition to occur. And we do have also a combination of the corticosteroids with prostaglandin. Remember that the source of progesterone in sheep, as we discussed last time, it comes from mainly from the placenta, right? So usually the placenta will take over the role of the corpus luteum in the sheep to produce, progesterone. That's why prostaglandin doesn't come as a primary choice or a first choice of drug for the induction of parturition in the case of sheep. So either have to give combination, especially when the stage is advanced, or you have to give corticosteroids, but not prostaglandin alone to produce induction in sheep. Estradiol benzoate is another option, but it's not really that much common nowadays. So we have to consider the other two. Goats. So goats are different from sheep, right, in terms of their primary source of progesterone. So basically in goats is like cattle. So we have corpus luteum as a main source of progesterone. So your choice of treatment or your choice of method for induction of parturition in the goats is going to be prostaglandin, all right? And obviously this will give a much better predictable timeline for the response of the treatment, okay? And of course, corticosteroids, because it acts on the fetus, leading to cortisol release, mimicking that cascade of parturition that we discussed. So corticosteroids obviously can be also used if you don't have the option to use prostaglandin, right? So yeah, this is the dosage and the time response that you can be able to see the parturition to start on. And for indications, more or less similar to sheep, we do have pregnancy toxemia, some reproductive associated problems. If you are considering to prevent, the newly born kids not to consume the colostrum, so you can be able to induce and then you can control the process of kidding, and then you can be able to immediately isolate or separate the kids from getting access to the milk. And this is an example of the disease is caprine arthritis encephalitis. So this is something that can be transmitted via the colostrum. Of course, to reduce doe mortality, because if you allow them randomly to kid to perform the birth, they may be stepping one over the other with the newborn babies around. So, but if you are there in a controlled manner, knowing the time of parturition, then you can minimize the loss that can come from this lack of management. In swine, similar to mares, remember, of having a similar placentation. So obviously, the drug of choice is going to be oxytocin. And of course, PGF2 alpha also can be used. And the indication is overdue, or meaning that a prolonged gestation period. Or if you have a swine that has been trying and have faced a dystocia problem in the stage 2 of parturition due to uterine inertia, then giving oxytocin can help to also resolve or reduce the parturition process, or to complete the parturition process. And this is also management perspective of planned farrowing. Then you can also use this method of induction. For dogs, we do have a number of choices to use, but obviously oxytocin is one of the options that we have. Okay, and the reason for using this induction in dogs is basically for management purpose. So the oxytocin is given especially when the time to well is close, so you can use up to 5 international units of oxytocin. Prostaglandin, particularly during the early days of pregnancy, until 20 days of pregnancy. This is a period where the animal will be, the pregnancy will be dependent on CL, okay? And then remember, there is also a prolactin role in maintaining pregnancy in dogs, in addition to progesterone. So anti-prolactin, these antagonist drugs against prolactin, which is commercially known as the cabergoline, can be used to induce also parturition, especially during the prolactin-dependent time period of the pregnancy, which is after 20 days. So you have got this dosage, and you have to provide this orally for a longer period. That's about 10 days. And then you can have the induction to on. This can also be combined with prostaglandin to make the process much faster. Another option is anti-progesterone. This is antagonist against progesterone. So it's known as eglipriston. So this also can be used as an option. But if you are talking about induction during the terminal stage, oxytocin is going to be the option. All right. So that's all about induction of parturition, which is preceded by the parturition process. All right, and this is just an example of a scenario for you, stating that this is a cow which is suspected of having a late-stage pregnancy, complained by the owner, and it was recumbent for almost 5 days due to suspected hind limb paralysis. All right, and this is a real case actually that we have visited a long time ago anyway. And then but the owner was he requested that because he thinks that the animal is not going to be able to survive, so he doesn't lose everything. So he wants to salvage the cow by slaughtering, but he is a bit worried about the pregnancy, meaning that thinking that maybe it's already mature full time, then if there is something that can be done, all right? So if this is a case that is presented to you, how you are going to address this problem. So think about the methods of induction that we have talked about just now. Consider the condition of the animal at the moment, 5 days being recumbent, off feed, reduced feed intake, and having this hind limb paralysis kind of condition. So you think about how you would go about the diagnosis, right? Of course, obviously, the first thing that you have to do is, because no record of breeding, time of insemination or mating, so you won't be able to know exact stage of pregnancy at this time. So the first thing that you have to do is to know and estimate the stage of pregnancy. And how you do that, now you know the story and you have the knowledge now how to do pregnancy diagnosis. Then after you do that, the next thing that you have to decide is, considering the condition of the animal, to choose how to get this baby out, right? If it is mature enough and be able to survive, then how we can be able to get the baby out before the cow is allowed to go for salvage, all right? Considering the condition of the animal's health and considering the interest of the owner who is in a rush to salvage the cow, irrespective of what's happening inside the uterus. So yeah, I just leave it for you to have a brainstorm on this and discuss about it and consider all the topics, relevant topics that we have discussed so far. Okay, so with that, I end up my lecture for today. You just have got a few minutes to go. I don't know if you have a question. There are 4 minutes. Of course, 3 minutes now. If you have any question, one question, I can respond.
Hi, Doctor. I just have a quick question regarding the case scenario. Is it possible if we try to save the fetus by C-section, by performing C-section?
Yeah, well, so you can do that, but for it to survive, what do you need to expect from the fetus? Can you be sure that fetus can be survived? You cut out and then you remove.
Um,
Ah,
yeah, I mean, so
so
does
it's
it,
not about just removing the fetus, right? Here, you need to also judge whether after you take out the fetus, whether it can be able to survive or not, right? Otherwise,
yes,
for example, if it's just an early stage pregnancy, or maybe like the first trimester kind of pregnancy or midterm period, so would there be any benefit of getting the baby out in whatever method that you follow, whether surgical or maybe induction? Will that be of a benefit? No, right?
yeah, no.
So yeah, so I think the first thing that you need to, because I wanted you guys to start from the beginning, from diagnosing the pregnancy itself. So probably your option can be yes, possible, but with the understanding that after you do your pregnancy diagnosis, you came to understand that the stage of pregnancy is really advanced, and you think that there is a possibility and a chance for this fetus to survive after you take it out. But then you are considering cesarean section, right? Why not induction of parturition?
Yeah, yes,
Huh?
yes. I can consider that as well.
So which one do you think would be the best option with the
Yeah,
reason?
induction.
Induction would be the better than cesarean.
Yeah, depends on the fetus viability and all.
Depend
So
on the fetus.
yeah, yeah,
Fetus
yeah.
what?
I mean, like if the fetus is, it is on its, it's like doctor said, we have to monitor from the first.
Uh, yeah. Well, at this point, what is more important is not about the fetus actually. When you talk about considering the options, whether to go for surgically to remove the fetus by cesarean section or to go for induction, the choice of the method of getting the fetus out, it should depend on the condition of the animal at this moment. Once you know that fetus is okay, it's advanced stage pregnancy, full term, then you have two options on the table. You can do cesarean or you can induce the parturition for the cow to let the baby out. But when you compare with these two, your basis should be more on condition of the animal. Because for the animal to undergo a parturition process, what do you think is expected from her? She has to contract, isn't it? Hello?
Yeah. Yep.
Yes. So you have to consider that. But I'm telling you that the cow is down, recumbent for 5 days off feed. You can see there is some tympany around the rumen. And with the hind limb kind of paralysis, one of the limbs, because with the rough handling by the owners, I think as they transport from Johor all the way to, I think it's in Langing. So this problem comes during the loading and unloading of the cow. So that is what happened. So you have to consider her condition. Will the cow be able to respond to this induction of parturition with the drag and get the baby out with the condition that she's having now? That's another major issue, right? So that is one thing. But another thing is the timeline. So remember, when you choose the induction method, one of the things is the speed of response that you have to consider, isn't it? So when you talk about the speed, there is no any method, especially for cattle, that will give you a response within hours. So it's going to be in days. So now 5 days animal recumbent, you know, if you add on more, then this cow has to be there struggling, you know, with extra days, isn't it? So considering all these factors, basically the option is going to be, I thought you will be brainstorming on it, but since we had the time, good that we have discussed on it. So to me, I mean, what we did and the best option that can be done for this animal is actually to do cesarean section, as you said, right? But you need to back up with explanations, which we just discussed now. So basically, you have to consider the condition of animal, the time response of the method of choice for induction. So having those two in mind, the best option is going to be cesarean, so that you can just quickly get the fetus out and allow the cow. If you have the option to treat this animal, the condition not severe, then you can also go ahead managing the cow to revive. But the owner's opinion and interest was to salvage the cow, because yes, very hard to rebreed this animal with this condition, with the limb also being paralyzed. It's going to be very tough for him, and medically also not feasible. So I think that's the best option for him to do so. So from our side, cesarean. So anyway, successfully the fetus was taken out by the cesarean section, and luckily it was also a mature fetus and it was able to survive. So that is the story behind. Okay.
Okay, thank you so much, Doctor.
So have a good day. That's all from me. Bye-bye.
Thank you,
Thank you, Doctor. Thank you, Doctor.
Okay.